gonorrhea. Right, so there are examples of diseases where if you see a case, or if a physician sees a case, they have to report it. And that's how the CDC is able to keep track of these diseases. Okay. What I want to do is just show you what the CDC site looks like. So, and it's actually a very helpful resource. So this morning I was talking with one of the representatives for Pearson, your textbook, and they're working about trying to design almost like an ebook or interactive ebook, changing the format to digital format. And so I was telling her about, we should really try to incorporate this website because it has such good information. So CDC.gov is the website, and again, their concern is about the health of the nation and how they can treat and prevent disease. So, World AIDS Day is coming up. That's December 1st, so they feature that. And if you scroll down, look at that. They even have a Twitter chat. I got to look at that. If you scroll down, you can see some other resources related to what we're talking about. So, we described emerging infectious diseases. There is, in fact, a publication they put out. And again, this is all open access, so you can download and read everything that is posted. Okay, and so this is a publication that you can get different kinds of current articles related to various health issues. These are just current. So these are current emerging diseases. Looks like worldwide. Okay. And also, I mentioned that we talked about morbidity and mortality. Right? There's a publication called Morbidity and Mortality Weekly Report, and so they report on different disease conditions. Now remember, we're focused on microbiology-related diseases, so infectious diseases. CDC has a broader mission. They're concerned about disease or health conditions in general, right? So, as many of you are aware of, right? One worry is about suffocation, infant death through suffocation when they sleep, right? So there's actually a posting about that. And also, what you find in this report is if you go into it, don't listen here per se. But they also, if you look through the report, you'll find all the statistics. They do this every week. You'll find all the statistics for the notifiable diseases. So, if you want to find the number of tuberculosis cases in Sacramento, you could actually in the Sacramento area, you can actually get that from this report, and you can get it week by week. You compare like Sacramento with, let's say, Washington D.C. or with the country as a whole. Okay. Any questions about that? Okay. All right, so that's MMWR, morbidity, mortality, report. Let me mention another term, nosocomial infections. All right, nosocomial infections. These refer to hospital-acquired infections. Okay, so these are infections that a patient gets from actually going to a hospital to try to get treated. Okay? Because there's a lot of injured and ill people in the hospital. That is actually a hotbed for spreading disease. So you actually may get another disease other than the one that you came in to be treated for. Okay? And it's actually a significant cost, a significant expense of our healthcare is trying to address nosocomial infections. Now, there are different sources for these hospital-acquired infections. One is it can be exogenous. That is, it's acquired from pathogens in the healthcare environment. So the building itself can harbor pathogens, right? So there are some kind of notorious, famous examples, famous sad to say examples of where, let's say there's pathogens in the air vents, and so they get spread from the room, okay? So that could be a source. There could be endogenous infections, that is, be acquired from the normal microbiota within the patient. All right. So there was actually an outbreak of Staphylococcus that occurred in a hospital. Actually, turned out to be the NIH hospital, which is one of the ground zero points, right? And they had these fatalities from Staphylococcus, which happened to originate from one of the patients, and just kind of spread throughout. And then there's another term. This is called iatrogenic. Right? Iatrogenic. This refers to infections that come from various medical procedures. Right? So catheter. Right? That's an invasive procedure. That can also introduce inadvertently pathogens. There can be diagnostic procedures, invasive diagnostic procedures, or surgery. Okay, so those are types of procedures that where the patient may actually acquire infection. So, what can affect, when you look at what influences nosocomial infections, this is just another way of looking at it. You can have microorganisms in the hospital environment as one contributor. The weakened immune system of the patients, that makes them more susceptible to these nosocomial infections. And also the chain of transmission, how the disease gets transmitted between patients and healthcare workers. And so it's the intersection of these three items that allows for these infections to occur. Okay? All right. So usually you see at least two or all of these elements play a role in how a disease gets spread, how a nosocomial infection gets spread. Okay. Any questions about this? All right. What I want to do is spend at least just a few minutes to get us thinking about the next topic, and then we'll take a break. If we want to at least get us going on that. So this is the next chapter. All right, so we're going to start looking at HIV, and we'll do this next time. But just to give you a few facts about HIV to get us going here. All right, a lot of you are familiar with HIV. Now we're gonna go back to some of the concepts that we learned when we discussed viruses. Okay, so you're going to see some of those terms come up again, right? And one term that we're going to learn more about is that HIV is a retrovirus. It's a retrovirus. So we're going to learn about what that term means. It has a single-stranded RNA genome. Right? So HIV has an RNA genome. Okay? Whereas you have what kind of genome? DNA. Right? You have DNA. Right? HIV has RNA. That will come into play when we talk about retroviruses. This is the causative agent of AIDS. Right? So this is the virus that causes AIDS. There are still a few scientists and other individuals who don't believe that, but pretty much the evidence strongly argues that HIV is what causes AIDS. And as a lot of you know, it's transmitted through the exchange of body fluids, so semen, vaginal secretion, blood, even breast milk can be a source of HIV, and it comes through these practices, which will of course sexual activity, injectable drug use, blood transfusion can be a method for spreading HIV, although we virtually eliminated this because now the blood gets routinely screened for HIV. So, like a blood source, this is one of the routine screens they do, so that eliminates this as a positive. Eliminates this as a way to transmit disease. but it can be transmitted that way. Also, mother-to-baby transmission. Right? So, in the womb, it can be possible to transmit HIV. And again, this has been eliminated. Does anybody know how? What can they do to prevent this transmission? Okay, so we don't have antibodies. It's actually not to the baby. All right, do we have HIV drugs that we give?
Yeah.
Yeah, we do. So it turns out that if you give the mother HIV medications, although it won't get rid of her HIV, it will control it. It won't get rid of it. It can actually break the cycle of transmission. Okay, all right. So that's one way of doing that. Any questions about this? Okay, so I'm going to stop here, and what we'll do is we'll take a break. When you get back, we are going to start a new lab. It's going to be on mold. So I'm going to, like last time, I'm going to say a few things about molds to get us going, and then we'll start doing the lab. Okay? Any questions? All right, so we'll take a break.
How long is our break? 15 minutes?
Yeah.